thing is it's detectable. In this week's Doc Talk, CBS 21's Chris Nallen tells us why cervical cancer awareness is key.
The following segment is sponsored by Geisinger Holy Spirit.
There's other cancers that can be detected or can be concerning.
It is cervical cancer that ranks fourth most common cancer amongst women. It is a detectable cancer, and doctors at Geisinger Holy Spirit highly recommend a screening,
Where we perform a pelvic exam and actually do a pap smear to screen for any abnormal cells of the cervix.
These screenings should begin at the age of 21 and continue every 3 years up to the age of 29. Additional screens after that could be 3 to 5 years.
Along with doing a co-test for HPV, also known as human papillomavirus.
Which is a virus that is passed from one person to another during sex. If a woman has this virus, she is then at greater risk of contracting cervical cancer.
If we know that a female does have cervical cancer, it is probably recommended that her partner also gets tested and evaluated.
There are a range of signs and symptoms if a woman has the cancer.
We call it breakthrough bleeding, but also intermenstrual bleeding, any pain with intercourse, certain things like that, chronic vaginal discharge.
According to the CDC, cervical cancer used to be the leading cause of death for women in the U.S., but that number has greatly decreased in recent years because of awareness and pap tests, along with a vaccine to prevent HPV.
The Gardasil vaccination now early in adolescent years to help prevent the occurrence of the transmission of the HPV virus.
For this week's Doc Talk, I'm Chris Nallen.